Hello everyone, good morning and welcome to my today's discussion about hypotensive anesthesia. What is the definition of hypotensive anesthesia and what are the goal or indication of hypotensive anesthesia? This is mainly the controlled reduction of the arterial blood pressure to improve the surgical field visibility by reducing the blood pressure in a certain level. What are the indication or where we uh, we will apply the hypotensive anesthesia in case of new surgery or ENT surgery and operation of spine or some other orthopedic operation. We can apply the hypotensive anesthesia. We will also consider about the adequate organ perfusion by reducing the blood pressure in a certain level without altering of any or without disruption of the cerebral autoregulation curve. Contraindications where we will never apply the hypotensive anesthesia. Number one, severe cerebral vascular disease. Number two, coronary arterial disease, aortic or mitral stenosis, renal or hepatic insufficiency, severe anemic patient or hypovolemic patient, and uncontrolled hypertension. What are the physiological consideration in case of hypotensive anesthesia? We must have the appropriate knowledge about some cardiac events to apply hypotensive anesthesia about this is pulse pressure, main arterial pressure, and cardiac events. What is cardiac ejection fraction, mean arterial pressure. This is diastolic pressure plus 1/3 of pulse pressure. This is the average pressure of arteries in a complete cardiac beat or complete cardiac cycle, from beginning of the contraction to the end of the relaxation of the heart. That is a complete cycle where the average pressure of the of a cardiac cycle is determined by main arterial pressure. In case of hypotensive anesthesia, our target is to reduce the 50 to 60 millimeter of mercury of the main arterial pressure, or 30% from the baseline. We will also consider the about impaired autoregulation curve. Here we must avoid to impaired autoregulation curve. In case of chronic hypertension, autoregulation curve is shift. We will have to consider about chronic hypotensive anesthesia in chronic hypertensive patient, and we must have to close monitoring of the patient for adequate cerebral or coronary perfusion. By which technique? we achieve hypotensive anesthesia. There is some mechanical techniques and some pharmacological techniques. In mechanical way, there is patient positioning. We can elevate the patient head in the 25 to 30 degree of the in patient bed, and we will there venous rhythm is also decrease and the cardiac output also decrease. In this way, the hypotensive anesthesia is acid and positive pressure ventilation also play a important role in case of hypotensive anesthesia, because positive pressure ventilation increase the interthoracic pressure. If the interthoracic pressure is increased, there is also decrease the venous rhythm and decrease cardiac output. As a result, the total arterial pressure or total blood pressure of the body will also be decreased, and hypotensive anesthesia is achieved easily by positive pressure ventilation. Some other pharmacological agent. This is the pharmacological way to achieve hypotensive anesthesia. There is many agents in which vasodilators, beta blockers, total intravenous anesthesia, and adjuvant also may be used. Vasodilators, in case of vasodilators, we can use sodium nitroprusside, nitroglycerin, nitroglycerin, etc. And beta blockers, we can use esmolol, labetalol. In case of total intravenous anesthesia, propofol plus remifentanil can achieve hypotensive anesthesia, and we can also consider about the volatile anesthetic agent, which is more suitable to achieve hypotensive anesthesia. In this chart, we can find that many induction agent we can use to achieve hypotensive anesthesia, in which intermediate decrease the main arterial pressure or may remain normal, and markedly reduce the cerebral blood flow and increase the decrease the intracranial pressure and increase the perfusion pressure. That's why, in comparison to other agent, intermediate is the first choice to achieve hypotensive anesthesia, and the second one is propofol. And propofol is also markedly decrease the main arterial pressure and decrease the cerebral blood flow and increase the coronary perfusion pressure and markedly decrease the intracranial pressure. And that's why propofol also the suitable agent for hypotensive anesthesia. In case of inhalational agents, we see that subfluorines decrease the main arterial pressure markedly and increase the cerebral blood flow and increase the cerebral perfusion pressure and increase or may remain normal the intracranial pressures. That's why sevoflurane is the first choice of in case of in volatile anesthetic agent to achieve the hypotensive anesthesia, and then isoflurane and halogen. We must have to monitor the patient closely, because if the cerebral autoregulation curve or perfusion pressure is decreased uh, or disturbed in cerebral autoregulation curve, there is more chance of ischemia, or uh, in case of kidney, and there is the chance of AKI, and uh, in some other cases where the beta blocker and vasodilator is suddenly uh, off, there is a chance of rebound hypertension also. So we will have to closely monitor the patient by interarterial line, and we will also have to monitor uh, oxygen saturation, internal carbon dioxide, ECG, urine output, EEG also. And we will also have to avoid the excessive depth of anesthesia. What may be the complication of inadequate in case of hypotensive anesthesia? If the inadequate perfusion occurs, there may be chance of ischemia of the and AKI and stroke. And there will be also chance of post-operative cognitive dysfunction in the elderly patient. And if we suddenly off the beta blockers and vasodilator drugs, there is a chance of rebound hypertension. And also, if any complications occurs, we must have to consider and manage very quickly. First of all, we will have to confirm the accurate BP, and we will have to avoid the depth of anesthesia, excessive depth of anesthesia, and if the hypotension is marked, there we will have to apply IV fluid, bolus IV fluid to increase the blood pressure, as some other vasopressor, or we will have to apply it, such as phenylephrine, ephedrine, etc. We will have to must have to consider some other and we will have to knowledge about, we will have to conscious about some other message, that is hypotensive anesthesia must have to use judiciously, and we must have to understand the drug pharmacology and patient physiology very well. We will have to closely monitoring of the patient, and individual patient is or in case of to achieve the hypotensive anesthesia, main arterial reaction is varies from patient to patient. This presentation is totally prepared from the full graduation anesthesia books of Morgan and Smith. Well, if you read the book, you may find more extra information. Thank you very much for your patience hearing.